Okay. You ये वापस फायरफॉक्स
Good afternoon to one and all present over here virtually. I requesting to Dr. Suresh Sharma sir and Mrs. Sonal Pandya ma'am start your video.
Okay, good afternoon, everyone. I, Ms. Pranita Christian, welcome you all on behalf of Sri G.S. Patel College of Nursing, constituent of Bhai Kaka University, for the celebration of Nurses Day 2021. It is a mark of our undying tradition to invoke the Almighty at the beginning of an important event. So let us all start with a prayer song. I now invite Shailesh sir to deliver the welcome speech.
Good afternoon. Am I audible, sir?
Yes, we can hear you.
Okay, sir. Educate and raise the mass, and thus alone the nation is possible. It is famous said by the Swami Vivekananda. Good afternoon to all. I am Shailesh Panchal, Professor and Coordinator of IQAC GHPACN, distinguished dignitary, Bhai Kaka of University officials, faculty members, nursing professional, Kadambari Alumni Association members and students who have virtually gathered here for celebrating International Nurses Day 2021. On behalf of our prestigious Bhai Kaka University and glorious Institute Shri G.H. Patel School and College of Nursing, I warmly welcome all of you. It's a great pleasure for me to introduce our panelist, Mr. Suresh K. Sharma, Professor and Principal, College of Nursing, AIMS, Jodhpur, Rajasthan. Dr. Sharma is a renowned person who has been providing uninterrupted nursing and educational services for over 2 decades. He has served a various capacity like principal and dean. He is awarding and honored professionally. Recently, sir is honored with the postdoctorate fellowship by International Council of Nurses, program of global nursing leadership institute, Geneva, Switzerland in the academic year 2021. Also served to national level assignment by the Ministry of Health and Family Welfare, Government of India. In additionally, sir service as editor, member of editorial board, and peer review of prestigious journals. His contribution to nursing research and publication is boundless and astounding. He is an inspiration to many. We are very grateful to Dr. Sharma for accepting our invitation and marking his virtual presence over here. Welcome you, sir. Education is far more than what happening in the four walls of classroom. And we are very fortunate to have such a teacher, trainer, instructor who recognize this. The next distinguished panelist present today is Mrs. Sonal M. Pandya. Madam is currently served as a lecturer of Government College of Nursing, Surat. Her strong determination and dedication serving to the nursing discipline is reflecting her long career as a nursing officer to educator. We are grateful to her for courteous and lady accepting our invitation to become our panelist. Welcome you, ma'am. Also welcome our university officials, respected principal madam, faculty members, alumni, nursing professionals, and loving students. I believe that participate in the panel discussion, we are the right place at right time. Together, let us accelerate the exchange of ideas and scaling up the good practices. With these words, I wish good health to all of you and for your family members. Once again, welcome to all of you and happy Nurses Day to all of us. Thank you.
Thank you, sir, for your earnest welcome address. Now I request the moderator of this panel discussion, Ms. Rankina McWan, to proceed for the session.
Dear all, may I have your attention, please? I am a nurse. These eyes have seen pain. These hands have touched hearts. This heart have touched a felt broken knees. These feet have walked 1,000 miles, all for our patients, because I am a nurse. With this, a very good afternoon to all respected panelists, faculties, and audience. I am Rinkina Makwan, faculty of Shri G.H. Patel College of Nursing, Karamsad, a constituent of Bhai Kaka University, and I am playing a role of moderator in this panel discussion. I would like to greet a warm welcome to one and all. The panel discussion is about to begin. But before starting this panel discussion, allow me to share 2 lines about us, about a nurse. Nurses are there when the last breath is taken, and nurses are there when the first breath is taken. Although it is more enjoyable to celebrate the birth, it is just as important to comfort in death. So, today we are celebrating International Nurses Day 2021. Topic for this panel discussion is same as provided by respective International Council of Nurses, which is a voice to lead, a vision for future health care. All the respective audience are requested to take part actively in this forum. You all are cordially invited to raise your questions in chat box for the reputable panelist. Now, let us begin the panel discussion with respected Dr. Suresh K. Sharma, sir. Sir, what is the concept of nurses as healthcare resources and why the nurses are pivotal as healthcare resources?
Thank you, McWin. And at outset, I would like to express my heartfelt thanks to Bhai Kaka University and Constituent College, Sri G.H. Patel School of Nursing and College of Nursing for inviting me and giving me the opportunity. I'm especially thankful for Madam Rekha Parmar and her team for inviting me here. McWin, answering your question, nurses are pivotal in healthcare delivery system. If you see healthcare manpower, 2/3 of the manpower are nurses. And nurses are the healthcare professionals who spend maximum time with patients, be it a primary healthcare system, secondary healthcare system, and tertiary healthcare system. Other healthcare professionals spend lesser time, be it a doctor, be it a technician, or be it other staff. Rest, if you see, nurses are not only paying their services for a micro division in healthcare. Nursing lasts from womb to tomb. And medicine comes in picture when there's a disease or illness. Because the primary role of doctor or medicine discipline is appropriately diagnosing a disease through assessment or a diagnostic test, and then providing curative intervention through drugs or surgery. Whereas nurses are providing care from womb to tomb and across larger people in the healthcare delivery system are very important. It is not to say COVID has proved it, that every disease may not have cure, but it has care, and care can bring a huge difference in recovery of the people suffering with such viral diseases like COVID-19. So now even the policymakers started rethinking and redefining the delivery of healthcare and the modality of delivery of healthcare now. Whether the model presently available is primary, secondary, tertiary, and primarily driven by doctor and nurses as an assistive into system is appropriate, or nurses need to play a driving role or a lead role, which the current theme of ICN, which says nurses, a voice to lead and a vision for future healthcare, is a very apt, and I'll let you know that the years are not far when nurses will lead healthcare delivery system. Sri Ravi Shankar ji, His Holiness once said me, Suresh, if we need to reform the society of India, we need to empower women in the family. And if we need to reform healthcare delivery system of this country, we need to reform nursing into this country. We have the best of best doctors, but nursing has not been empowered. Nurses has not been given sufficient authority to make decisions. That is the reason healthcare delivery system is still suffering in this country. So nurses at large have a very important role in healthcare delivery system, which nobody is denying today. Thank you very much for this question.
Thank you, sir. So, sir.
McQueen, you have two devices together, so you need to switch off one, otherwise echo will continue happening.
Yes, sir. Yes, sir. What is the current status of nursing services nationally and internationally?
This question to me?
Yes, sir. This question is for you, sir.
Okay. If you look globally, nursing discipline has grown significantly. Nurses are providing their role as a bedside nurse. Nurses are also into role of clinical nurse specialist. They are also into role of advanced nurse practitioners. They are faculty, they are deans, they are directors, they are vice chancellors into universities. Whereas in India, nursing has yet not grown to a level which it would have grown in last 70, 75 years. Nurses are limited to bedside nursing. We have handful administrative responsibilities for them like ANS, DNS, nursing superintendent. In some central government hospitals, we have chief nursing officers. In academic side, yes, academics has grown significantly, probably because of the requirement of nurses globally, and we started producing more of nurses. But that is again in private sector. Research has not picked up well. It is into its infancy. In administration, if we look, our directorates in state and directorates at center is very, very weak till now. In policy making, nurses has a very limited interference. So yet it has to grow to a magnificent level. And I urge from this platform that the government must realize this and start investing more on nursing and midwifery, and must give more autonomy to nurses and to give more legal authority for nurses to practice and see the change into healthcare delivery system and outcome of healthcare delivery. Thank you.
Okay, thank you, sir. The next question is again, looking to the current scenario, which are the areas of development for better nursing services and how to intervene?
In between, somebody came. Can you repeat the question?
Yes, sure, sir. Looking to the current scenario, which are the areas of development for better nursing services and how to intervene?
मैं फोन કર્યો એકવાર તો અને મેં કીધું કે થોડા ટાઈમ આવતી હતી. શું કીધું તને અહીંયા સેલરીનું?
Participant, please mute yourself. Participants. Sorry to interrupt, sir. Participant, please mute yourself.
Thank you. So there are several areas of improvement. Look for nursing education. What kind of nurses we are producing today? If I look back in my time, when nurses were trained in hospitals, and there was only 3 months training, and post PTS for general nursing and midwifery, nurses were placed in hospital and they were taking training and becoming competent to provide basic and some level of advanced nursing care. Then we have shifted to university level education, that is BSc nursing. And the more and more private institutions started emerging, they had very limited clinical training scope for nurses in their own hospitals or affiliated hospitals. So kind of nurses which we are producing today, they are bookworms. They are good into theory, but from, I don't say all the institutions, but most of the institutions.
Sir, your mic is muted. Kindly start.
Oh, sorry. So I was just saying that there's a huge scope of improvement, and I will begin with the womb. Womb is nursing education. Nursing education began, if I remember my time, then nursing education used to happen in a different way, which is happening today. That time, 3 months training, PTS and post PTS, it was just a hospital where they were taking training and they were clinically competent to come out and serve in any setup, either it's a PHC, CHC, or a district hospital or a tertiary care hospital. But now, once there's a mushrooming of institutions has happened, they have very limited clinical facility or clinical material to train nursing students today. And I'm saying with great responsibility and a disappointment that majority of nurses today passing from India, they are not clinical practice ready. Clinical practice ready means if you put them in hospital today, they require some level of training, otherwise they can't provide safe care. The reason is they are taught in classrooms, they are taught into skill labs, but they're hardly getting sufficient time to get a clinical competency on core basic skills. I'm talking about history taking, physical examination, injection administration, IV cannulation, catheterization, catheter care, suctioning. Basic care nurse is not able to deliver. And that is the reason that once nurse goes to a hospital, she is not respected. because she learns being there from team. Similarly, these nurses are not competent enough. That's why they are not much respected in international market today. I keep visiting to developed nations, be it the US, Australia, UK, Ireland, and they say that Indian nurses were very good in past, but now Indian nurses are not well trained. They know theory, but they are not good in clinical practice. We need to train them for a year or half, then they become resource to us, and by the time they leave and go to other hospital. So they are preferring Philippine nurses. There are only two countries in the world, Filipinos and India, who are best two suppliers. The maximum 80%, 85% nurses go from these two countries. And they prefer from Filipinos because their nurses are more clinically competent and practice ready. So we need to bring reforms into nursing education. Now, how to bring reforms? There's a long journey, and I think that National Nursing Midwifery Commission bill comes. It comes into right hands and right minds. Probably there will be reform in nursing education. If I come to hospitals, in hospitals, large number of the nursing positions are lying vacant. Those need to be filled immediately by the governments. The working condition for nurses in hospitals are not good. There's no sufficient facility to live a ordinary life. They don't have even washrooms to, evacuate their bladders while being a 6 to 8 hours or long shifts. So these are issues which government need to look. There's a very serious issue is in a private sector that the salaries are not regulated. In some of the small nursing homes, nurses are paid as low as 2,000, 3,000 rupees. What happens today in that? There's a Supreme Court order that minimum wages for nurses won't be less than 22,000 rupees per month. But it has not yet been implemented in any state. The reason is our associations are very weak. Nurses are very submissive. We are not having representation into political system. And then until nurses do not have system influence into politics, these decisions cannot happen. So these are two core areas where we need to work. Then things will start. We need to prepare clinical practice ready nurse who can immediately go and take up role. And I let you know, I like German model of training. In Germany, they train specialty nurses at baccalaureate level. They train for 3 years, they call it general nurse, registered general nurse, where they teach them fundamentals of nursing, medical surgical nursing, general, and public health nursing. And anatomy, physiology, basic science in 3 years period. Once everybody have done 3 years, then there's a 18 months specialized training. Either it's a midwifery, mental health, public health, critical care, cardiothoracic. After 18 months, you get specialty certificate and you go and work only in that area. You go in neonatology, you go in pediatrics, you go into mental health, and you are expert of that. We are producing a generalist. She neither knows the basics of nursing and neither she is a specialist. And if you put her into mental health or dialysis or ICU, she is totally blind. So we are not producing clinical practice specialist nurses at undergraduate level. That is one thing which I believe that India will do in future. So that's an area where we need to be. Thank you.
Thank you, sir. I'm again appealing to the audience to raise their questions in chat box for the reputable panelists. Now let us move forward to the next question, which is for Dr. Suresh K. Sharma, sir. Sir, what are the gaps to bridge and flows to overcome for betterment of nursing services?
There are large number of gaps. The first gap is nurses are not into policy making. There had been a little hue and cry that the nursing cell or nursing division into Ministry of Health and Family Welfare must be strengthened. Nursing advisor post is lying vacant since last many years. There are only 5 positions which are sanctioned and only 1 position is filled. 4 positions are lying vacant. And still with 4 positions, the cell is very weak. For such a large country, the nursing division need to have the full-fledged division as other divisions are functioning in the ministry. So that is the one area where it need to be strengthened, because until unless we will not win to policy making, our voice will not reach to the government, to bureaucrats, to the politicians. Second gap is, I believe nurses must do a strong lobbying. At least one nurse must be nominated by Rajya Sabha, so that she becomes a member into assemblies where the bills are passed. So our nursing bills are reached to parliament, but they keep lying there and they never get passed. So we need to have one nurse. From medical fraternity, there's a person. From sports fraternity, there's a person. From economic fraternity, there's a person. From humanities, there's a person. Nursing is such a large community in healthcare delivery system. Why not at least one? I say there should be minimum 2 nurses nominated for a Rajya Sabha by the politicians, and then they keep hammering that these are nursing issues which need to be taken up by the government. And the same thing must be, I think, echoed now loudly and largely, so the nurses can have the influence into politics. Until unless nurses will not into politics, the policy will not be affected. Until unless the policy will not be affected, the reforms will not happen. So I say that the directorate at state level, directorates at the state levels, there's a in West Bengal, in Orissa model is very good. Directorate is got created. But what happened? Today, a doctor is sitting there and he is occupying the nursing director's position. So nurses in that state must not that let to happen. Similarly, in each state, in a directorate of health, there should be a division of nursing, or there should be separate directorate where there's a director of nursing, joint director of nursing, assistant director of nursing, and then director which is for nursing services, for nursing education, for public health must be there, so that there's a portal for nurses to represent and their problems are solved. Otherwise, when there's only medical directorate, the nurses issues are diluted, because doctors have their own channels and their issues are heard and they are done. So I think we need to work at these levels so that things start happening. Other important thing is that our associations are very weak. As an individual, you are nothing. As a single stick, you are nothing. But large number of sticks are together, they are a strength. So nurses must be strengthening their associations so their voice becomes loud. And then these voices are heard, because it is a democratic country where there is a political system. So I think if we work at these levels seriously, there's something which good is going to happen, I believe.
Thank you, sir. Now, I'm again want to ask you one question, that is, what do you opine regarding existing nursing curriculum in context of future healthcare services? And does it require any modification in the context of current scenario?
Mike, this is a very important question you have asked, which is very close to my heart. It's very well said that any curriculum which is not revised after 3 years becomes rotten curriculum. And Indian Nursing Council curriculum, which is existing, has been revised in 2006 last time. So 16, 10 years, and now 21 is another 5 years. 15 years, same curriculum. One child who is born becomes a docent, and he's ready to take up a new curriculum, professional life. So any curriculum which is not revised in 3 years or 5 years is a rotten curriculum. So you can understand what is the situation of curriculum which we follow. Second take up is, if you look into Western curriculum. Western curriculum has gone concept-based curriculum and competency-based curriculum. Our curriculum is a currently content-based curriculum, which used to be in 1940s, 1950s in US. And that time, the nursing people from RAK went to US to take their doctorate into education, and they brought up this curriculum. And since this curriculum has been almost all same, just fine tuning here and there. So we need to have a 360-degree change into our curriculum. We need to go to competency-based curriculum so that we can produce clinical practice-ready nurses. Nurses which are ready to take up a clinical role or educator's role. Otherwise, what will be producing? You can see what's happening in the market. A nurse who is passing BSc can't give him one injection, or can't put an IV drip, or can't put a catheter, or can't put a Ryle's tube. What is the use of having a 4 years degree in that? So curriculum need to be changed immediately. Thank you.
Thank you, sir. Next question is, what will be changing role of nurse for future healthcare system?
Yes, nurses' role is rapidly changing in Western world, and it has to happen in India if government want to reform the nursing healthcare delivery system. Nurses were at bedside. They were following the order which has been given by the doctor, but now nurses are making decisions. Nurses are practicing independently as an advanced nurse practitioners. They are giving their consultations. Now, not only this, at micro level, nurses are required. They have specialists who are specialized into promoting breastfeeding. They are specialized into monitoring appropriate growth of the newborns. They are of normal healthy birthing process. So I think these micro specializations are very important, and we need to bring these into practice. Therefore, I'll tell you, the new generation will feel attracted if we have these specialist role for these nurses. Otherwise, they are not attracted because they feel that there's only bedside nursing, some administration, some education, nothing else more than that, or little more public health. So on a Western pattern, they have really done reasonably good. We need to bring this clinical specialist role or specialist role for nurses so the young minds will be attracted. And once they are in a micro specialization, they will having a deeper knowledge, and they'll be more proficient, and they will enjoy it, and public will be benefited. Thank you.
Thank you, sir. As sir is having another schedule, so he need to leave this meeting. But I'm thankful to you, sir, on behalf of Shri G.H. Patel College of Nursing, a constituent of Bhai Kaka University, for accepting our invitation and sparing such a valuable time for us and sharing such informative this knowledge with us, sir. Thank you so much, sir.
Thank you so much for inviting me, and once again, thank you everyone. Thank you very much. Bye.
Hello. Hello. I just wanted to say the hello. Left, no? Yes, ma'am, you are audible. No, actually, my question to sir, but sir has left. So that's why I just keep telling you that.
Sir is here, ma'am.
Yeah, sir is there. Okay. Hello. Am I audible?
Yes.
Sir, I would like to ask one question to you, sir. Hope sir is there. Okay. Sir, I'm Raksha Parma, principal of Nursing College, and would like to ask one question. Hello. Hello. I think sir is not there.
Sorry to interrupt. Let us continue with the rest of the discussion by asking question to the other external panelists and our faculty. Thank you. Go ahead, Rankina.
Really sorry for such technical errors. Now, I want to ask a question to Mrs. Neela Darji ma'am. Ma'am, what are the reasons of continual scarcity of nursing force across the globe and how to overcome it?
May I audible? Thank you, madam. The scarcity, regarding the scarcity is not a new problem. So this problem is across the globe, even before the pandemic. Even I won't say that before the pandemic, but at the time of the Florence Nightingale. That is why. Okay. So it is not before the pandemic. I will go ahead. It is the times of the Florence Nightingale. The scarcity is there, right? That is why we already learned in the history that Florence Nightingale wake up to the so many nights and they have worked for the soldiers. But if we say the causes of this scarcity, the biggest problem already sir discussed, that is the migration, right? Very first day when the students come students join the college and we'll ask into the introduction why you have joined the nursing field. Student will 90% student will say that we want to go abroad because there is so many chances, good remunerations are there. That is why we wanted to go abroad. So though we produce more nurses, but the scarcity will remain there because the majority student migrate. Especially in our Gujarat and in the Charodar area, the thing is like that only. To go abroad, they choose this is the way. As a way, as a path, they choose the nursing. So it is pre-decided that though we will become a registered nurse, but we won't work over here, we'll go abroad. So scarcity is major problem nowadays is the migration is the major problem. Second problem, we say that the aging workforce. As you have survey or you have seen in that the clinical side, 2/3 nurses over at the age of the 50 or over the 50. So what happens? They are on the roll. But what happens sometimes due to their aging, they have the health issues, they go on leave, they will sick frequently, and the retirements. So though they are on roll, but when we see at the clinical side, the actual nurse won't be present there. There will be the gap. We won't able to maintain the. If we so on the road, 200 nurses are there, but actual working, so many remain maybe on leave due to their aging, their sickness, some other functions. So there is again the issues. Then also the second will say the limited supply of the nurses. Though we produce more, but the supply is less. We already told the migration is the biggest problem. So they don't want to join here. So many go for the work abroad. So many students go on the student visa basis go abroad. Though sometimes the institutions advertise for the nurses, they won't
comes, doesn't wanted to join over. So these are the main parameter of it. Secondly, as we know that the majority are the females in this field, right? What happens, some after completion their graduation, they do work, but when they get married, the in-law says no, doesn't, you no need to do work, we have enough money, you manage our home, you manage your kids. So again, they work for 1 to 2 years and they will drop. So these are the major cause for the nursing scarcity according to me.
So, Neela ma'am, what measures to retain the nurses in nation and prevent the migration of nursing force?
Okay. So, prevent the migration, first we'll have to find out why they wanted to migrate, right? So, we already heard that there are the good remunerations. Here, especially in the private sector, they are paid very less. So, for that, so it is a very much important to increase the remuneration or that's then working condition is not even the safe. It is the responsibility of the nursing leader, those who are the superior, they are working in that the same institution's responsibility to say the management for their good and conducive environment so that they can work nicely. Secondly, we have to give some extra benefits to them, like maternity benefits are not getting in all private sectors. Some other like the medical benefit, high risk allowances, something should be get. Then also sometimes I have heard so many times, okay, they leave the job. Why? They're not relaxation in the duty. Not relaxation in the duty means their scheduled duty. Sometimes due to the emergency, they wanted to change their duty. Some in charge say no, you have to come in this duty. So many conflicts occur. Finally, as we know, okay, all are not needed of the money, but then also they do the job, they leave the job. So especially we have to increase the remuneration and also we have to make nursing continuing facility for the continuing nursing education for the professional growth to retain the nurses. Thank you.
Thank you, ma'am. Now let us go to the Sonal ma'am. Sorry, ma'am, for making you wait. Can you please, ma'am, throw light on psychosocial problems faced by nurses while dealing with the patients?
Okay, thank you, Rankina. First of all, I would like to express my thanks to Madam Raksa, who has given me this opportunity as a panelist. And I wish you all happy International Nurses Day. My first question is, what are the psychosocial problems it is faced by the nurses when they are dealing with the patient? Okay, so already sir told nurses, they are not getting that much facilities. Okay, so because of that, and we all know nurses, they are working day and night, working 24/7. Why? Because to ensure the safety and mainly good health of the others. So nurses, they are looking always best for the other. They are not they don't have that much I want this. Okay, so they are always there for the other, and it is in a daily routine or in disaster. Nowadays, you can see the pandemic. It is since 1 or more than 1 year. It is there, and nurses, they are always on the front line. And they are always providing holistic care. So nowadays, this approach, it is there, comprehensive and holistic care nurses has to give. And because of this COVID-19, so healthcare facilities also, it is affected, mainly frontline workers, they are also affected. And because of this, they are not only facing physical problems, but they are also facing psychosocial problems. And why these psychosocial problems nurses they are facing? Because already sir and madam has mentioned, due to shortage of staff. Okay, so from India, their staffs, they are migrating to other countries, and some institution they don't want enough staff. Like already IMC and all, they have given ratio If patient is on ventilator, 1:1 ratio is to maintain. In general ward, different ratio has to maintain, but all hospital, they are not maintaining that ratio. So first and very important, why these nurses, they are facing psychosocial problem or any physical problem, because first and very common nowadays we can see it is due to shortage of staff. Second, if shortage of staff it is there, and because of this, those who are working, they have excessive. Okay, so if you will see in private hospital, nurses, they are doing even night, and in morning, no one is there to relieve them. So again, they have to do morning shift also. So because of excessive workload, and again, long working hours. So as already I told you, if no reliever is there, so that nurse has to compulsory do extra duty hours. Then they have worry about their family, they have worry about their child, they have worry about themselves also. And because of that, nurses, they are facing lots of psychosocial problem. First and very common problem nurses, they are facing, it is burnout. So I think burnout, it is new term for, I think, for audience. So burnout, it is what? So here, if we can say, it is mainly, it is state of three things. So first and very common, it is emotional exhaustion. Okay, so emotional exhaustion, second, it is mental exhaustion, and third, it is physical exhaustion. So why this is occur? Because that already I have mentioned, because of excessive workload, because of long working hour, because of shortage of the staff. And due to that, nurses, they have stress. And if stress, it will be longer. If it is that stress, it will continue, it will excessive, then that nurse will face burnout. So first and very common problem nurse will have, it is burnout. Second, they have fear. So what type of fear mainly? So fear of infection. Okay, so long hours nowadays, if you will see in COVID, okay, so without any break they are doing, okay, and they are away from their family. So because of that, they have fear of infection. Okay, maybe in future I will get, and we all know that some nurses from Gujarat, even from Surat also, we lost them because of COVID. So second and very important, it is fear. Third, it is emotional disturbance. So here emotional disturbance, so mainly why it will occur? So they cannot able to share their feelings, they cannot able to ventilate because no one is there to listen them. Okay, so because of this, maybe they have emotional disturbance, or you can say emotional exhaustion. Then they have anxiety and distress. Okay, so anxiety and distress means what? Ki how I can able to manage. So this is one anxiety. Okay, if we will give them, okay, today you have night, tomorrow again you have to do morning shift. So they have that fear, they have anxiety whether I can able to perform my duty hours politely, means with dedication or not, because we all are human beings, and more than 8 hours if someone will give our work, so we cannot able to perform what exactly we want to perform. So maybe they will have anxiety and distress. Then feelings of personal danger, so that already I told you, fear of contact or fear of infection. Then because of this nurse is being isolated, they don't want to share, because they are like that, if I will share also, then also no one will going to solve my problem. Okay, so sometimes they are being isolated, they don't want to come out. Then because of this all, they don't have that satisfaction, like job satisfaction, it is not there, the life satisfaction also it is not there. Okay, so if we will ask someone whether we have to go in nursing field or not, so this exhausted nurse, they will not say, they will say, now don't go, you choose other line. Why? Because they are facing this all problems, and because of that they have poor life satisfaction. Then very important physical problem, or you can say it is psychological problem, it is insomnia. Because of this all stress and burnout, they cannot able to take proper sleep, they cannot able to even take that proper diet, because our shift hours also it is different. And now because of COVID, if one will wear PPE kit, so they cannot remove in between their duty hours. So loss of appetite, lack of sleep also it is there. Then high it is stress, so that already I have mentioned before, if stress it will continue. So first phase they will have stress, and if stress it will go ahead, then that person will have burnout. Then this it will continue, like stress it will continue, that person will have burnout, and if burnout will continue, then that person will have depression. And if that nurse or that any person will have depression, and finally what they will think. Okay, three main triad they will have, like helplessness, hopelessness, and worthlessness, and finally they will go for suicidal ideas also. So nowadays this is also very, very common. Then general public, healthcare workers and mainly nurses, they will think of this suicidal, means they have this suicidal tendency. Then I cannot say कि they don't go for substance abuse also. So I have seen some nurses, those who are working mainly in OT. Okay, so long duty hours they have to, means scrub nurse, as a scrub nurse, if they have to perform for a long time. So substance abuse also, it is very common among nurses, those who are working in ICU and those who are working in mainly OT. And due to this long hours, so main other thing they have, it is separation of the loved one. Okay, so nowadays we can see ki in COVID, so we have here in Surat, if I will see ki then nurses, they are not going home after COVID duty. And why? Because they have fear ki if from COVID positive patient I'm dealing with, and if I will go to my home, so maybe chances of getting infection to my family members. Okay, so because of this, they have that continuous stress, separation from the family, and because of that also, that nurses, they have problem. Second and very important thing I have seen in government area, so it is redeployment. So redeployment, it is what? Ki nurses, they are coming here from far places as a deputation. Okay, so job they have to perform same only, but from their special place, for COVID-19 only they are placing into other place. So this is also very important adjustment problem they have. So this problem also, it is very important, and it is known as redeployment. So this is also very, very important point I want to mention. It is also very common nowadays. Then sometimes feeling sad and nervous, they will become very irritable. Sometimes crying spells will occur. And because of this, they cannot able to do or perform that good. Means they are not that much competent. Means whatever they have to give, means productivity of that nurse, it will not that much good as what she want to give. Then also, despite of all these obstacles, despite of all these challenges, our brave nurses or these brave hearts, they are serving 24/7 with dedication and with devotion.
So, ma'am, how these nurses should overcome these all problems?
Okay, so already I told you before also why this problem will occur. So first and very important is shortage of staff, heavy workload. So first we have to find out what are the problems nurses are facing, and already sir and madam told. And today Nurses Day we are celebrating each and every place. Okay, so those leaders we have to tell please do something for nurses. Okay, so everywhere all are listening to other department, but no one is there to listen to nurses. Is it? So first and very important point, first we have to find out cause. So if we will find out problem, and every problem has solution. So, and second important thing, some nurses I have seen they don't want to update their knowledge. Okay, so if they don't want to update their knowledge and skill, then also they are prone to get this type of psychosocial problem. So first, how they can overcome this type of problem? So first it is, nurses should be well equipped with the knowledge. So whatever CNE it is there, whatever they like this panel discussion, then workshop and seminar, compulsory they have to attend. So by means of that, they will get, means they have to update themselves. So because of this, maybe chances they will have less stress because they know what is the line of treatment. So if one can know line of treatment, and nowadays new machineries also are coming in market. Okay, so they must know how to operate it. And if they know, so automatically they cannot able to face this all stress and all. So first, nurses should be well equipped with their knowledge and skills to manage this type of crisis like COVID-19. Every time line of treatment they have changed since beginning. Okay, so they must update their knowledge. Second and very important is support from the leaders. So that already I mentioned before also, support from the team leader. So it is also very, very important. What are the issues among nurses? So they have to solve that issues by providing any like recommendation, by providing implication. Okay, so issue whatever nurses have, so compulsory uska means it must have solution. Then shortage of staff, it should be overcome by recruitment of means HR department should be active where shortage is there, so compulsory. So now also in government you can see ki they have operated waitlist staff. Okay, so by means of this they are doing something. They have operated waiting list. So shortage of staff we can minimize. Then no scarcity in the medical resources. So medical resources, like if patient, like if I have 10 patients in my ICU and I have only 5 ventilator, if one patient is in critical condition, so how I will find out ventilator for that patient? So automatically nurses have to be in stress. How I can manage this? Only one ECG machine is there in whole hospital. So so these are some emergency instrument, emergency drugs and all. So availability of enough medical resources should be there. Then organization should ensure flexible schedule. So flexible schedule means not every time, but not that much rigid. Okay, you have to perform like this. So some flexible schedule if we will give to nurses. So for them also working environment should be like a friendly working environment we have to maintain. So by means of that they can able to perform, means productivity will be good if we will provide this flexible environment. Then very important is moral and motivation of the staff. Okay, so how we can raise this moral and motivation of the staff? By giving some rewards. If nurse has done, like in some hospital I have seen ki this nurse has delivered this many, means conducted this many deliveries. Okay, so one time I met one nurse. So in 1 month she has conducted more than 300 deliveries, and given some incentive to that nurse. Okay, so by means of this, like moral and motivation of staff, or mainly nurses, how we can, so by means of incentive, by means of giving rewards. Then second and very important, we have to treat all nurses with justice, and means discrimination we have to avoid. Okay, means favoritism we have to avoid. So by means of that also we can overcome this type of problem. Then in hospital very lacking it is proper communication. Okay, so proper communication, we all have organization chart whom we have to talk. If I have some problem, so proper and effective communication will be there in all institutions. So by means of that also we can. Then I have never seen in hospital they have any stress management strategies and all. So compulsory administrator should promote awareness about mental health, because mainly we all are focusing on physical health only and we are not focusing on mental health. So this is also very, very important. The organization must promote awareness of mental health, what exactly mental health is and why it is very important. So if we are not mentally healthy, then also we cannot able to perform our best. Okay, so by means of how we can able to get awareness, so by means of organizing any awareness classes or stress management workshop, etc. Then staff rotation, like it should be also there, like from higher stress area to lower stress area, like ICU nurse or OT nurse can go in light ward, and light ward nurse can go into OT, and those who are highly demand areas. And nowadays it is also very, very important is budding. So maybe I think, I don't know whether you know or not. So budding, it is what? Ki senior experienced person has to work with the lower experienced person. So we have to make like this pair. So those who are junior nurse, so they can take guidance from the senior nurse, and because of this, we can minimize stress of that particular nurse. So by means of this, what will happen? So means we have to do this pairing. And by means of this, what are the benefits of this budding? So knowledge we can transfer. Means senior nurse can transfer her or his knowledge to junior nurse. Then by means of that, junior nurse, they can get training also. Then by means of this, junior nurse can improve their confidence. Okay. And say third and very important, ki work bonding we can increase. Okay. So these are the some steps we can do, ki by means of this we can able to overcome psychosocial problems.
Thank you, ma'am. Now let us move to Neela, ma'am. Ma'am, which are the challenges faced by nurses in our country while working with healthcare setup?
So in previous question, we discussed regarding the shortage of the nurses, right? So this working with the shortage or with the scarcity, that is the biggest challenges uh, for the nurses. I am audible? So this is one of the biggest challenge. With the scarcity or with the low supply of the nurses, we have to work. And in the pandemic, this is again magnified. Though previously the shortage were there, and due to this pandemic, so many fall sick. We have lost so many nurses, and they increase the scarcity. This is the biggest challenge. Second challenge, working at the working place. This is the workplace hazards. Nowadays, though the institution will give the advertisement for the recruitment, why we are not getting the nurses due to the hazard. We have some fear in our mind, not some. We have so many fear, and we thought that if we'll go or if we'll work with the patient COVID, definitely we infect, or it will infect our. We go to the home, it will infect our family member. That is the current scenario. But if we go into the past, also there were the hazards. HIV patient were there, hepatitis B. There are so many hazards, right? So this is one thing to face the challenges. Uh, Third one is the violence at the workplace. Daily in the newspaper we read somewhere in some corner, a patient or patient relative rushed into the hospital. They were hit the doctor, they were hit the nurses. Violence are there, right? So this is again the biggest challenge. We are putting ourselves into the danger, and we have to work. What happens, when happens, we don't know. One side the viruses are there to attack on our body. One side the patient and the patient's relative are there to attack on our body and mind. One way our superior are there, because also they are also on the stress. They have to give the answers to the management. Another medical team will come and order on us. So simultaneously we have lots of work, and we continue, we work under the pressure. This is the again biggest challenge for the nurses. Then our work is a high pressure job. We have to follow the physician order. We have to help into that some procedures. We also have to perform so many procedures, from the basic care to the high care, like the sponge bath, mouth care, and rice to feeding to give the O2. So many things. And nowadays, due to the neck and documentation is also the important, lots of paper. Secondly, what is another challenge is we got sometimes the new nurse, but with the little bit of that resources, we have to do the work, and simultaneously we have to train. So that is again we have to spend the time with that new nurse to train them. So what we'll do? We will train them, we'll do our work, we'll give time on medicine. What we'll do, that will be remain in our mind. So these so many challenges are there. Secondly, we have to meet the patient satisfaction. Sometimes patient call us, we are busy, we won't give proper answer. Patient won't satisfied, they will become the angry. Then our personal health issue. Nowadays it is the biggest challenge. Not even our personal health issue nowadays. Our family members' health issue. We experience in our family also, our family member become infected, but then also we have to go to the duty. We not able to take care of our family member, but constant our superior call us, no, you have to come on the duty. Just before 2 days I will give live example. I won't say the name of the institution or nurse. Saturday in afternoon, one nurse, my friend, called me and asked me, you તે કશું જાણ્યું? મેં કહ્યું ના. My husband expired due to the COVID, and she start crying. Now what I can do on the phone? Then after few minutes, she become quiet. and she told કે દુઃખ તો મને એ વાતનું છે કે my husband expired but my superior say હવે expire થઈ ગયા છે તો થોડા જીવતા છે જે ડ્યુટી પર આવી જાઓ. So this is a challenge how they can go their mental ability, and also she was also sick simultaneously. She didn't I don't know was she was also the COVID positive or not. So this is a challenge how they will go there. तो वो मुझे ये बोल रही थी कि still it is my husband the ritual is incomplete, जो लास्ट हमको जो लास्ट रिचुअल्स करना है. Again challenges, they have to go to the job, how they will work, how will stable their mental stability, how will maintain their mental stability. So these are so many endless challenges. See, we are sitting over here, it is at the teaching side, but here really we go to the clinic, we take one round, we feel cry. So it is a great challenging for the nurse. Thank you.
Thank you, ma'am. Now my question is for Mrs. Sonal Pandya, ma'am. Ma'am, what measures nurses should take to enhance mental capabilities?
Okay, so already before I told ki what are the problems nurse has to face. So here as an individual, what nurse can do to maintain or to enhance mental capacity. So first and very important, ki adequate rest and sleep. So how that nurse can get adequate rest and sleep? So that she has to manage anyhow. So sleep and wake cycle, like one article I have read, ki nurse they have shift duties. Okay, so every shift she has to manage, like her sleep and wake cycle, it is disturbed day by day. So she has to manage, like today is her night shift. Okay, so again tomorrow maybe she has day off. So whatever today she is doing, so same tomorrow she has to do. Then only her circadian rhythm should be maintained, and it is also very important. And because of this all problem we can, whatever problem before we have seen, so that nurse can able to minimize. So first, if nurse has to maintain mental ability strong, so she has to take adequate rest and sleep. Second and very important, it is adequate or healthy diet. Okay, so healthy diet, I think you all know ki what it is contain. So each and everything, like all balanced diet means it is full of all this like vitamins, minerals, carbohydrate, fat and protein and equal whatever requirement according to that she has to take. Third, ki as a nurse, actually we are also not doing this. Okay, so along with our this work schedule and all, we have to identify our hobbies, and we have to carry out some activities and hobbies unrelated to work. So every time we are doing work, but we are not finding time for us. So here, whatever it is unrelated to work, that hobbies and some activities we have to find out, and we have to do that activities. So some relaxation time we need. Then fourth one, it is exercise. So we have to maintain it in morning or whatever our shift is there. So accordingly, we have to maintain what is the exact or suitable time for us to do some exercise. But that exercise one has to do regularly. Then in diet, one has to reduce caffeine. Okay, so and because of caffeine, maybe we can induce our sleep. Then second and very important, whatever neurotransmitter it is there, because of this, it will release and it will help in our like proper management of ourselves. Then we have to practice some relaxation techniques like mainly yoga and all. So that also we have to learn, means we have to give some time for ourselves, in short. So by means of that, we can able to enhance our mental capacity. Then next, that we are also not doing like spiritual and some religious activities. So this is also very important. From our own time, we have to find, we have to identify what activities I have to do. So we have to involve in some like Lions Club, whatever clubs are there. So in that also we can go and we do this all religious and spiritual activities. See, actually Lions Club, they are not doing this type of activities, but we can spare our own time in this type of thing. Then very important is make time for ourselves and make time for family. Every time we are doing work, but we have, this is also very important. Otherwise, our family members, mainly our children, they will think, hey, mummy or dad, they are only doing job, they are not giving time to us. And because of that, maybe our child, they will also develop some psychological problems. So it should not be that. So we compulsory, we have to give time, means we have to do work and life balance. Okay, so this is also very important. Then very important is practice mindfulness. So what all things we have to cover in mindfulness? So that already before I told you adopting maybe relaxation techniques. So how we can, so relaxation technique in that yoga, meditation and all we can do. Then we all know deep breathing, and some yoga we know, and in free time also, that like in chair also we can able to, whenever we will get time, so we can do that thing. Then we have to stay organized. Stay organized means what? Whatever our routine it is there. So we have to identify what is of my routine. So haphazardly don't do anything. So because of that also our mental capacity will go down. So always we have to stay organized, and by means of this we can do this. Then practice physical self-care. Then if we will have like I'm mentally ill or some problem I will have, so don't hesitate. We have to seek compulsory help from someone. Then some diversional activities we can do, like listen some music. If we have, like we dancing, that also we can do. Aerobics we can do. Then laughing also, it is best method. So if we are alone in home or in workplace, we can laugh. So by means of this, all this muscle also it will get relaxed, and neurotransmitter also will release, so that mental depression it will go down. Then very important is connect to others. Don't be isolated. Always we have to connect to others. Like during the pandemic also, whatever we have not called before some friends. So now it's time to connect with others. We can call. So whatever means far away from us. So by means of virtually we can able to connect. So connection, we connect with others. It is also very important. By means of this, we can able to share our feelings. We can able to share our ideas. So by means of ventilation, so it is also very important ki whatever we have in our mind, so already we have ventilated our feelings, so we will feel relaxed. Then try not to overcommit. Not to overcommit means whatever it is in our hand, so that much only we can do. Don't that much dedication dikhane ki there is no need, because automatically you are harming yourself. So don't be that overcommit to someone. Okay, so I think these are the some ways. So by means of that, one can able to enhance mental capabilities.
Thank you, ma'am. Now my question is for Neela, ma'am. How a nurse can give best care by using holistic approach?
Holistic approach is a comprehensive approach. First of all, we have to start thinking on that, to providing the holistic care. Actually, what we did into the clinic, we have given the medication to the patient, we have given the injection to the patient, we have, if the rice tubes is there, we have given that, our duty is over. Or we feel that our task is over. This is a sad part of nursing. Though we are doing the things, but we are not applying the holistic approach. So first we have to start thinking on that, and we have to start giving the care on the base of the holistic approach. So as we all know, the holistic approach is the total care. What we do will center only the physical care, right? Or not even the care. We follow the doctor's orders, and according to that, we'll give the medication to the patient, we treat the patient, and we think that our role is over. But nurse can provide the holistic care, or nurse can dispense the care without the physician's or the doctor's order. So what comes under the holistic approach? Main thing we forget, that is the patient psychology. That is the main thing. Just we have discussed the challenges in that I told you the violence of the patient and patient relative becomes the violence. Why they become a violence? Because if we'll go into the route, we are not providing the holistic approach. They won't say that કે અમને ટાઈમે મેડિસિન નથી આપી સિસ્ટરે અથવા તો અમને ઇન્જેક્શન ટાઈમે નથી આપ્યું. But they are not telling anything what they are doing. They are not telling anything. They are not involving in the care. What they have to do, anything they are not telling to us. Their main problem is અમને કશું કહેતા જ નથી કે શું કરે છે કે શું કરવાનું છે. So that we have to set what are the procedure will do. Before that, we have to explain, not just the mechanically. What we do, we explain કે ભાઈ આ કરવાનું છે, આ પ્રોસિજર લો, અહીંયા સહી કરો, કઈ પણ એની જવાબદારી અમારી નહીં. For that only we will tell the patient, not to just win their confidence. We have to provide the holistic care to win their confidence. Once we'll win the patient confidence, they will cooperate us. They will cooperate us. It is easy to caring the patient, to treating the patient. We just talk, therapeutic touch, educate the patient regarding their disease, what they have to do, what they have to eat, why they have to eat. These little things comes under the holistic approach, and really it improves our quality of the care. Spend the time with the patient. It doesn't mean you go, you say the scarcity is there and how we can able to spend time with the patient. We won't have time to talk. So when we go to the patient while giving medication, while giving rice, we talk with the patient relative, we talk with the patient, and we start the communicating with the patient. Patient we have to gain the patient confidence that way. So it is a very much important to provide the holistic care. Give the spiritual care. Let them pray. Let them follow their virtues or their religious things. Sometimes what happens, some Jain patient came into the ward. They have to take the insulin after the 7 o'clock. We say, no, our hospital is thinking that you will get a diet after the 7:30, so that you have to take the insulin after 7:30. But we have to follow their spirituality. We have to respect them. It also comes under the holistic approach. Then it is easy to treat the patient, to care the patient. Thank you.
So, ma'am, according to you, which fundamental component need to be improved
for better healthcare?
I already told in the above point that main fundamental component is the communication. Very, very important, the communication. Talk with the patient, talk with the patient relative, therapeutic communication. What procedure we are going to do. Everything is needed to inform the patient and patient relative. Not only the procedure. When the patient admits first time into the hospital, we have to introduce ourselves, who we are, what help we do them. All the things we need to communicate with the patient. And also make them comfortable, so we supposed to be easily approachable, so that patient can able to approach us anything they have query. Let them liberty to talk with us when they feel to talk with us. Secondly, providing the safe environment. Safe environment means harmful no harm. When they in the hospital, from our side, they should not be harmed. They should not be harmed means another infection from our side should not be get. That is the second main component for the fundamental. Then we should show the compassion. We are providing the care, but robotic way, not in the compassionate way. That also we need to start. Then we have to educate them regarding that already I told, and offering the empathy to the patient. So these are the key fundamental components for the patient.
Great.
Thank you so much, ma'am. Now, time is flying so fast, and you have been facilitating a brilliant panel discussion. Now, my last question is for Sonal, ma'am. Ma'am, what facilities should be made available at every settings for the nurses for their mental as well as physical well-being?
Okay. So I think actually workplaces are an optimal setting to enhance mental and physical health. Okay, so as an organization, what organization has to do for his or her staff? So first important key, already before also I told you ki very poor communication it is there. So there is no like effective communication between organization and all. So here very important ki they have to establish communication structure. Ki to whom I have to contact and from there whether my problem it is solved or not. So this is also very important ki every organization or every setting has to establish communication structure or communication pattern. Second, policies should be established for the all healthcare workers, not only the nurses, but here commonly I can say ki for all healthcare workers, policies should be made. Then support networks. Ki if I will have this type of problem, so to whom I have to contact. So these three things, if it is there in the organization, so all problems we can able to solve. So first, effective communication. Second, policy should be made for all. And third, supportive network. Okay, to whom one can contact, and by means of that, every problem can be solved. Okay, by means of this if we will utilize, so automatically one can improve their mental health awareness. And I don't know whether you know or not, but in nowadays in private institutions also they are doing some program for nurses. Okay, so nowadays because of COVID-19, I heard one thing ki Hausla, they have given one term Hausla. So this is the team. So they are giving Hausla means what? Ki aap aage badho. You do whatever you want to do for patient and we are there for you. Okay, so in between they are gathering nurses, they are gathering some even ayas and all, and they are doing something for them like musical event and all. So by means of that, so this is what? This is one type of network. Ki by means of that, ki aap aage badho, we are there for you. Okay, so in our hospital it is going on. So this is one from our psychiatric department only they are doing this. Ki aap karo, we are there for you. Okay, so they have given this name, it is Hausla. So this is also organization has to, because nowadays nurses, they are in very stress. So by means of like this program, their mental and physical well-being, we can able to manage. Second, in second question also I told you ki buddy system. So here mix and match, like senior we have to cap with the junior. So by means of this buddy system, we can able to improve one's mental health and we can improve productivity also. Then third, we have to organize awareness program related to stress management, related to relaxation. So in every institution, it should be there. Like some stress management strategies, all has to. In morning mein aake what they have to do. Like if they will start with that work with the prayer, so automatically that productivity will be high. Then enhance support to the family. So here we are not dealing with only our employee, but we have to deal with the family members also. So enhance support to the family if they will have any need to the family. So compulsory organization has to do something for their family also. Very important it is in-service education and continuing education. So before also I told you ki if nurses having knowledge and skill, so our productivity will be high, they will not be in stress. So here also continuing education and in-service education, it should be there for all the nurses. So by means of that, they can update their knowledge, they can update their skill. Then they have to give work break. So like nowadays, if you will see in pandemic, so in some hospital, I have seen 10 or 15 days, they have to do work and 5 days they will have this quarantine. Again, after 5 days, they have to join COVID duty and again 5 days break. So this is also very, very important time for relaxation. By means of this, the stress level one can reduce. So work break should be there. Then before also I told ki schedule should be flexible. It should not be that much rigid, ki compulsory, whatever it is written, so that nurse has to follow. So some flexibility in the schedule if we will give, so automatically that stress level of nurse we can minimize. Then provision of mental health and some psychological support system should be there. Then very important is appropriate delegation. So appropriate delegation means I know what my juniors they can able to, okay, what is their ability or what is their capacity of doing things. So that before delegation of work, I have to identify whether they can able to perform that or not. If they don't know, and we have assigned them that particular duty, so compulsory they will be in stress. So delegation also, it is very important to whom you are giving or you are assigning that work. So this is also very important, appropriate delegation and distribution of work. Then recreation at regular intervals. Okay, so how we can, like if they have off duties, so we can go for any trip. So by means of this, like get together, work bonding also will occur, and recreation also we can able to give to our nurses. Then fixed pay leave, whatever they want leave, so that also we have to give. So like every time it's there I ask leave, but my superior, they have not given me leave. Just now madam told after that of that sister husband also, they have not given her leave. So this is also very like typical situation that we cannot able to. Okay, so here also whatever our hub means, whatever our leave, so that fixed leave should be there. Then last and not the least, financial support to the nurses. It is also very important whenever nurses want some financial support, so organization has to do, or organization has to give this support to the nurses, and by means of this, I think nurse can able to maintain mental and physical well-being.
Thank you so much, ma'am. I'm again appealing to the audience to raise their questions, if any, in chat box for the reputable panelists. Okay, now let me summarize the panel discussion.
Ravina, sorry, Renkina, sorry to disturb you.
Yes, ma'am.
I have a question, or even it can be a suggestion also to Sonal Ben. Madam, I would say that yes, during by imparting our curriculum, we strengthen our student theoretically, yes, practically also, yes. But I feel that there should be some enrichment topic or content to be imparted during the first and second year. Like just now it came in my mind, and looking to this current scenario, COVID, that major issues which current nurses and younger nurses basically are facing it stressed, right? So there should be some stress management session, life skill management session, time budgeting and time investment sessions. I think that curriculum it should have in the curriculum. And yes, we can even suggest to INC also that from the very beginning, because it should be rooted from the basic level. Of course, then later on, after being a nurse, they can have the various sessions. So in continuity of that sessions, they can be strengthened. So here we need to strengthen them very well. And I think this is the right period to strengthen through the first from the first year and second year only. What do you say, madam?
Yes, ma'am, it's true only, but I think no one is focusing mainly on mental health. It is
that's the problem.
Yes, whatever I have seen, always we are hiding. If I will be in stress, then also I cannot able to even, I can also not able to share my whatever feelings I have. So we are hiding actually ourselves, and we are not sharing this. So we are mainly focusing on our physical health. That's why these all issues are coming, ma'am.
No, my concern is it is not necessary that students have stress and then only we teach them management.
No, it's not like that.
Psychology, we teach them in psychology. We teach them how to manage the stress and frustration and this and that. So certain sessions, especially for the nurse, for how being a nurse we can manage our frustration, or release our stress. So certain hours should be allocated for students' activity.
Yes.
And the simulators, the basis of simulator scenario, like many regarding fire safety training and another this thing, they are doing some training. Okay, so some mock drill they are doing. So certain kind of mock drill, through giving mock drill, we can judge whether where the students are fall and how much effort we require to strengthen them. Okay,
Yes,
because now from the school only, nowadays if you go through, children are so pampered from the parents. Even
Yes.
from the very small age, they are very pampered. They never ever seen a single trouble or difficult in their life. Even for little bit difficulty, parents always would fulfill everything. So they never think that what is actually difficult time and difficulty or struggling life and all these things. So they never came across that. So I feel that there should be some special hours in the either in the first year or second year. Then it can be continued in the third year, and then they can start implementing it. Okay, so this is
So we can forward this to our council. So
of course. Okay,
suggestion, ma'am.
thank you so much. Now Rankina, over to you.
Thank you so much, Raksha ma'am and Sonal ma'am. Now I'm going to summarize this panel discussion. Initially, Dr. Suresh K. Sharma sir have given their suggestions and answers the questions by this. To spend maximum time with healthcare system, policymakers should started rethinking about modality for primary, secondary, as well as tertiary level of healthcare system. The lead role should be by nurses in various settings. Empowerment of nursing should be there, so that only reformation of nursing profession could be able. Now, second thing he shared that globally more as advancement is there, but like faculties and nurses, whether in nursing in India, nurses it doesn't expand it. Nursing field is not expanded much. It is only for the bedside clinic or bedside nurse or ward nurse or nursing superintendent, CNO. So yet it has to grow more, and government should spend more for nurses and for legal opportunities for nurses. Another thing, sir shared that several areas of empowerment has to be good in theory. Means students and nurses are good in theory, but not in practical. So once the nurses are go to hospital, they must train in hospital only instead of laboratories and labs. Sir again added that they know theory but not competent in practice. So it must be focused that skills should be developed rather than only theories. Then there is large gap in our system. Not nurses are policy makers. Means nursing policy should be made properly. All positions are not vacant yet. So it should be filled by Ministry of Health and Welfare. We need to have one nurse in Parliament in Rajya Sabha, so who can nominate our issues in the Parliament. So policies should made of nurses to solve their issues. Again, he said INC curriculum has been revised since last 15 years. So it must be revised every year. Sir said that micro specialization should be there in our nursing profession. Then Neela ma'am said about scarcity. It is limited supply here. So due to it is from migration of the nurses to the abroad. So majority, another thing Neela ma'am said that majority are females. They do marriage and can't do work enough or sufficiently. So they can be, the issues are arised. To prevent migration, remuneration should be given to the nurses, as well as extra benefits should be provided to all the nurses like maternity benefits, high risk benefits, relaxation in duties, etc. Sonal ma'am said that nurses working day and night, so they are holistic care. Shortage of important thing. So they didn't maintain the nurse patient ratio. So norms working hours due to such a kind of shortage, so that psychosocial problems are arise. This psychosocial problems are like burnout, What is burnout? Ma'am explained very well about burnout, that emotional, mental, and physical exhaustion is called as burnout. And due to extra workload, fear of infection, and all these things, these psychosocial problems has been arised. So insomnia, isolation, fear, emotional disturbances, hopelessness, homelessness, these things can be leads to suicidal ideas and substance abuse. So, and another one thing she added that redeployment means deputation in government areas. This may leads to adjustment problems. So productivity decrease due to these things. To reduce this kind of things, first we have to find out the cause. To develop knowledge and competent. Due to knowledge and competence development, only we can attain our goal. So shortage should be filled by recruitment. No scarcity in medical department means every resources should be available for nurses. Flexibility in schedules and duties. Maintain friendly environment for the nurses. Motivation by giving rewards to the nurses. Then proper and effective communication to organization channel and organization chat and communication channels. Organization must promote mental health, such as staff rotation should be there. Then buddying means senior and junior nurses should be collaboratively work, and work bonding should be increased. Then Neela ma'am said there are challenges faced by our nurses like health hazards, then violence at workplace. We have to perform various procedures. We have to train new nurses, and personal health issues as well as family health issues can reduce the work potential of the nurses. Sonal ma'am said to enhance mental capability, sleep and rest properly because circadian rhythm should be maintained. Adequate and healthy diet should be taken by the nurses. As a nurse, identify our hobbies and we have to do accordingly. Relaxation time we should take. Then exercise, reduce caffeine in diet. Spiritual and religious activities should be promoted. Then make time for ourselves as well as our family members. Practice mindfulness, relaxation techniques, deep breathing, yoga. This should be enhanced by our nurses. Ventilation of feelings is must. So overcommit. And another one thing is overcommitment. Means do not be overcommitted. Then Neela ma'am said about holistic care, we have to start giving holistic care, means total care should be given to the patient by providing therapeutic talk, therapeutic touch, and all these things. We have to spend time with the patients. And fundamental thing is communication, therapeutic communication, explaining to the patient everything is must. She added that safe environment must be enhanced for the patients. And at last, Sonal ma'am said, we have to establish proper communication channel and communication pattern. Policy should be made, supportiveness, a supportive network should be there, appropriate delegation of the work, financial support to the nurses. And at last, Raksha ma'am has given suggestion about stress management strategies should be enhanced in every setting. Strengthen nurses is very important. So by mock drill, we can give training and strengthen our nurses. So this is all about today's panel discussion. I would like to say thanks to respected panelists for such an informative and interesting talk. And I extend my thanks to audience for your active participation. Hopefully, the panel discussion will be beneficial for everybody. Thank you once again for your precious time. Now, I'm handing over to Ms. Pranita ma'am. Over to you, ma'am. Thank you.
Thank you, ma'am. International Nurses Day is celebrated around the world on 12th of May, the anniversary of Florence Nightingale's birth. The theme for 2021 is Nurses, a Voice to Lead. And the sub-theme for 2021 is A Vision for Future Healthcare. We will have a short video to know more about what International Nurses Day theme reflects.
International Nurses Day is celebrated every year on May 12th. The day commemorates the birth of statistician, nurse, and social reformer Florence Nightingale. The event itself was established in 1974. The International Council of Nurses, a federation comprised of more than 130 national nursing associations who all represent over 20 million nurses worldwide, has established its 2021 focus for International Nurses Day in highlighting the future of nursing and innovation. The International Council of Nurses commemorates this important day each year with the production
If video is not running, you can skip the video and invite Sailesh Bhai to announce the winner's name. Pranita? Request Sailesh Bhai
Okay. It's time to announce the winners of essay and poster competition organized as a part of Nurses Day celebration. So I request Shailesh Panchal sir to announce the winners.
First of all, I congratulate all participants and winners who dedicatedly give their efforts to make this event successful. We are organizing essay competitions and the poster competition. After going through the numerous participants, we are selecting the best 3 entries for the winners. So I just announcing essay competition winner names. First, third position are Mr. Preston Parmar, first year basic BSc Nursing of GH Patel School and College of Nursing, Karamsad. The next, second position in the essay competition, Miss Riya S. Patel, first year basic BSc Nursing of GH Patel College of Nursing, Karamsad. And last, the first position held by Khushi Mekwan, third year basic BSc Nursing of GH Patel College of Nursing, Karamsad. Congratulations to all of you. Now the second part of the poster competition, the third position by the Anjali Patel, second year basic BSc Nursing of GH Patel College of Nursing. Then second position, Hemangini Bekwan of first year basic BSc Nursing of GH Patel College of Nursing. And the first position of the poster competition was the Mansi Patel CS College of Nursing, Ahmedabad. Many congratulations to all of you, and please collect your winner prizes. Thank you.
Thank you, sir, and congratulations to the winners. I would now request Mrs. Saksha Parmar ma'am to give vote of thanks.
Thank you, Pranita. First of all, happy Nurses Day to all the participants, faculty, and all the guests. First, I would say that Dr. Suresh Sharma, he accepted our invitation and he been our panelist. We know Dr. Suresh Sharma since long because we refer many books of him. Many time faculty suggest that yes, you refer Suresh Sharma book. Okay, so this way he is well known to all of us, and we are lucky to have him here as a panelist, and we have a face-to-face discussion here through this platform. Sir has given a valuable input, whatever the questions raised by the moderator, and heartily thank you so much, sir. My special thanks to Sonal Madam and Sonal Madam for elaboration of all the psychological issues and their proper measures, okay, suggested measures, and yes, that can be implementable, and yes, that can be reduced also. Thank you so much, Sonal Ben. My gratitude towards Neela Ben for elaborating all the issues of nurses at the clinical settings and overall problems of the nursing profession in the healthcare sectors to elaborate in such nice way. Thank you, Neela Ben. I must thank to Provost Madam, Registrar Sir for allowing us, for giving us opportunity to celebrate the International Nurses Day, provided all these technical facilities to execute this program uninterrupted way, and very nicely we have executed, sir. And my special thanks to Provost Madam and Registrar Sir and whole Bhai Kaka University team. Again, my thanks to the team of the GH Patel, those who have organized this seminar very nicely, panel discussion very organized way, all the competitions managed very nice way. So all my faculty and team for the success of for the successful execution of this program. Last but not least, those who have participated and helped and cooperated us, supported us in celebration of this Nurses Day. Thank you so much, this technical team, especially Dinesh Bhai, communication department, computer department, all are really our backside heroes, and they are supporting us, and because of them only we just ran this program very nicely. Thank you so much, all of you. And lastly, I would say, without participants, yes, my dear students, of all the students, all the participants, those who have attended these sessions with the patients and gain some good productive knowledge. I think it's a really wonderful discussions we had in the panel through the panel discussion. And yes, you need to absorb this content, you need to modify your behavior, you need to learn many things to be a future strong nurse. Okay, so thank you so much, all of you, for to being with us. Thank you, and once again, happy Nurses Day. And lastly, I'm congratulating all these winners for participation in the activity wholeheartedly. Thank you so much. Thank you.
International Nurses Day is celebrated every year on May 12th. The day commemorates the birth of statistician, nurse and social reformer Florence Nightingale. The event itself was established in 1974. The International Council of Nurses, a federation comprised of more than 130 national nursing associations, 20 million nurses worldwide, has established its 2021 focus for International Nurses Day in highlighting the future of nursing and innovation. The International Council of Nurses commemorates this important day each year with the production and distribution of the International Nurses Day resources and evidence. The theme for the 2021 resource is Nurses, a Voice to Lead, and the sub-theme for 2021 is A Vision for Future Healthcare. So in 2021, the theme, or you can say the aim, is to show how nursing will look into the future as well as how the profession will transform the next stage of healthcare. The ICN president said, "This global COVID-19 pandemic has shown the world the important role that nurses play in keeping people healthy across the lifespan. While there has been significant disruption to healthcare, there has also been significant innovation that has improved access to care. So in 2021, we will focus on the changes to and innovations in nursing and how this will ultimately shape the future of healthcare." So the IND 2021 theme reflects on the impact of COVID-19 on the health system and the nursing profession and how these might be affected in the future. Nurses, as the largest healthcare profession, must play an integral part in planning the future of healthcare. So every year, ICN produces a range of resources to inform the public and support nurses. So this includes a report, case studies, posters, videos, interviews, and social media banners and logos. So this year too, ICN is calling on nurses to share their stories in the form of a case study so that it could be a part of IND 2021. Nurse innovation in the face of an unprecedented global health crisis will be the focus of International Nurses Day 2021. The International Council of Nurses is searching for nurses across the world who are taking the lead on service redesign or new ways of working to act as case studies for their campaign. Alongside the encouragement of a fully deserved congratulations ode to nurses, the organization also produces an International Nurses Day kit to educate and assist health workers around the world with a different theme each year. So past publications have focused on working with the poor, fighting AIDS, equal access to care, and sustainable development. So, as we celebrate International Nurses Day on May 12th, let us highlight, understand, and appreciate the role of nurses, their achievements, and all they do for the healthcare industry.
Okay, thank you everyone. Here we come to the end of our session.